On this episode of Med-Surg Moments,
I just finished my nursing theory class. One thing that I found really interesting during this coursework was that we were actually allowed to use AI.
I last talked about how this year I want to get my CMSRN.
We set him up for bedtime at 7 o'clock, which is fairly early. And he just screams as soon as we leave the room.
Y'all, I'm finally on my own as a clinical instructor.
I don't know why I waited so long. It was just the fear. I was so afraid. And I think it was just the fear of failing,
So our topic today is getting serious about nursing wellness.
Working as a nurse, it's so hard to balance taking care of yourself and also taking care of your...
I think we all need to say, I'm the sixth patient, and I need to take care of myself just as much as I take care of anyone else.
I've got 4 kids, a husband.
It's going to be a very different generation of people coming along.
The generational thing, I think it's also affecting the mental health thing, because someone older might be like, pull yourself up by your bootstraps. And then the younger generation is like, you need to go to therapy. This is Marcella,
Eric?
Trish,
Kellye,
Sydney.
and Haley. Welcome to Med-Surg Moments, the MSN podcast.
This podcast is an engaging look at the lives of and surrounding medical surgical nurses.
We're proud Med-Surg nurses just like you, sharing our stories, insights, and experiences to support you in your nursing journey.
So our topic today is getting serious about nursing wellness. But before we get started, let's begin with some personal updates. Sydney, why don't you get us started?
I just finished my nursing theory class. I'm so glad for that to be done. It was a lot of papers this time around. It was interesting learning about all the different nursing theories and things. One thing that I found really interesting during this coursework was that we were actually allowed to use AI for papers. I mean, AI wasn't a thing when I was in nursing school anyways, but I'm curious if other schools are integrating that into their curriculum, because it's kind of inevitable that students are going to be using AI. So they're allowing us to use it as long as we source it, and we have to put a disclaimer in the appendix that we used it. But it's been really interesting to kind of learn how to use AI responsibly academically. So that's one thing that I found interesting about that class, and it'll be interesting to see if my university continues that going forward through other master's classes. But other than that, wedding planning is going good. The new department head position is going good. I found a Dutch oven at the thrift store today, a Le Creuset Dutch oven for $10. So my sourdough is about to really start popping off. I know I said last time that I was watching the carbs, but I have to make a sourdough loaf now. I have a Dutch oven now. So that'll be my update probably next time, is how my sourdough came out in my fancy new Dutch oven. Trish, how about you?
that is amazing. I just have to say first about the Dutch oven. So the weather here continues just beautiful. It was like in the high 70s today. The flowers are coming out and it just makes you not want to stay inside. Makes you just want to be outside. I'm looking out my window at work going, oh, so thankful. We haven't been to any baseball games yet, my husband and I, but certainly want to get out there soon. Haven't been able to do much shopping, but it will come. It will come. Work has been busy, but I'm sure all of our work has been busy, right? That's the essence of Med-Surg. But I find it interesting about the AI. I did write an article recently for the Med-Surg Journal, and you could also use AI for that. I guess we've come a long way in our society, right? Marcella, how about you?
Hello, everyone. Professional updates. I last talked about how this year I want to get my CMSRN. I have made no progress on that. It's just kind of hanging out up in my brain. But other professional update is that we went live with our Epic upgrade. So last Saturday, I had my little rover in my hand, and as float pool, I was on a burn unit that day, and it's one that I'm not super used to and don't go too often. So I felt very uncomfortable that morning with getting my patients. That scared me a little bit, even though that unit is really great about not making me do the special dressings. But It being a unit I'm not familiar with, and then we had the whole new system, I was very nervous. But overall, 2 thumbs up. Sometimes you have just that extra 2 pills or something that you go into the room and you don't want to bring your whole computer on wheels. And I love the little scanner on my rover. The patients were really great too. They were aware that 2 nights before it went live. So I was luckily not the first day of go live. That's true chaos. This was 2 days later. And the patients were super patient. I'm like, can I just practice this with you? And they were great. The only heads up I would give if people are using this is after you scan your medications, you also have to do like a cart checkout. And if you don't, and you go back to the nursing station, you think you just did all your meds, it says incomplete for like all your medications. So that's just my little tip, as now I'm a Epic Go Live Rover professional. I love tapping my badge. We didn't have that before either. That was lovely. And then personal updates. I have continued to take my sleep seriously. I'm very excited about that. And I can already feel the slight percentage increase of energy in my day. And also my kids, me not being anywhere near my kids at night, they are sleeping better too. Like the baby, he woke up like once and I was able to just whisper into the camera we have, like, go back to bed. And he actually went back to his bed and went back to sleep. I was in shock. So I think we were both actually ready for this transition and separation. A little sad, but a lot more happy than sad.
He was probably terrified. Imagine little baby waking up in the middle of the night and you hear a voice from the corner room.
They're used to this technology. I love this. I didn't have all this with my first, who's now 16. It's probably terrible, but they're going to get used to it in society too. This Overwatch cameras everywhere. Haley, what's new with you?
Marcella, I'm pretty much the opposite boat of you. My 2-year-old is going through a sleep regression, unfortunately. So we set him up for bedtime at 7 o'clock, which is fairly early. And he just screams as soon as we leave the room to sing more songs. He likes the color song with the rainbows, and he likes You Are My Sunshine, and he likes that little creepy song, the little Tiptoe Through the Tulip song. So we sing it high pitched. It's very fun, but very weird. I had an ultrasound earlier this week as well, and we found out that it is another boy. So I am, for the powers be, it is destined for me to be a boy mom. So lots of fun. My son's going to get a little brother, which I'm very excited about. We have our Joint Commission survey that's coming any minute, and very eager for our last Cerner Joint Commission survey. We are elbows deep in restraint audits, as you can imagine. And everybody is already so nervous about answering the questions for when Joint Commission comes in. So hopefully I have a very happy update for next episode that Joint Commission gave us a gold star and multiple A+. Eric, how about you? What's your update?
Doesn't Joint Commission always pass everybody? I mean, don't they give like a 2-week notice for their surprise visit?
Supposedly not, or unless they don't share it with us.
Well, it's pretty smooth over here. I'm in the same boat as Sydney with school. I don't know why I waited so long. It was just the fear. I was so afraid. And I think it was just the fear of failing, because now that I was like, I can't get anything less than an A, and I'm working full time and I'm trying to take care of this and that and personal life. I was just so afraid of it. And once I was finally pushed off the board, it's great. I hate to say it, but some things are actually really interesting. A lot of it's not. A lot of it's kind of just paperwork. I feel like if I see another discussion post and 2 replies that are 150 words in length with 2 references, I'm going to go crazy. But it's really good and I'm excited. And I think I've only got another 2 classes. So I'll see what's going to happen. I think I might just roll it in and keep going, but I'm not sure yet. Work, on the other hand, is going great. Not too many complaints. I don't know. It's something in the air, but it's just been so busy. And it's like a different kind of busy. It's like a crazy busy. I don't know what it is. Something happened over this last 2 years. We don't see a lot of walkie-talkies anymore like we used to. It's so much more total care, so much more work. So I don't know if that's something that's just like in our area, but it just seems like something happened. I don't know. Kellye, what's going on with you?
All right, Eric. Well, no, I agree. I totally agree with you. Something is going on because the patients are not simple anymore. We're dealing with that over here. But for me, professional updates, y'all, I'm finally on my own as a clinical instructor. I was off orientation a couple weeks ago. I'm taking on my students alone, and it's just been amazing. My students are all doing very well. They passed their midterm evaluations. They are on to shadowing opportunities in the other areas of the hospital. So I just love their energy. I love their eagerness to learn and things like that. So I'm just trying to keep them motivated. I'm trying to keep them interested. As far as my skills labs, I do Wednesdays for my skills labs groups. And so those groups are going well. I'm actually leading some of the demonstrations for the students. So that's going well as well. Personally, right now, I'm finally getting back into the groove of going into the gym 2 and 3 times a week. I fell off a little bit these past couple of weeks. It's just been so busy. But going back into the gym, I'm meeting my 2 to 3 week goals. I am spending more time in church, more time with praying, and just getting my students also involved and just having a prayer life. For those ones who are interested, try not to push religion, but prayer is very, very important going through nursing school. Why don't we move on to our topic, getting serious about nursing wellness? We talk a lot about patient wellness. We prioritize safety, recovery, and prevention for the people we care for every single shift. But when it comes to our own wellness, it's often a different story. Running on empty, skipping meals, ignoring warning signs of burnout, or telling ourselves this is just how nursing is. Today, we're having an honest heart-to-heart, nurse-to-nurse conversation about what nursing wellness means and looks like to each of us. We're also getting vulnerable about our own struggles and the times we haven't taken the best care of ourselves. Who would like to get us started?
Kellye, I can't disagree with you on your statement about prayer. Hearing about your nursing students and thinking of my last semester in nursing school, I always tell people it was on my grandmother's candlelit prayers that I made it because I needed like a crazy percentage on my final test. I had the flu. It was really terrible, and I thought for sure I'm not going to make it. Sure enough, I did, and I decided that it was because of her prayers. But that kind of brings us back to taking care of ourselves. With that flu, I didn't realize that one day I'm going to have the flu or I'm going to have any other kind of exhaustion. And working as a nurse, it's so hard to balance taking care of yourself and also taking care of your patients mentally, physically. And I have to admit, I often overdo it. I overdo it with my complete patients. I'm like, I don't need help with this turn. I don't need help with this boost. And at the end of the day, I'm like, oh my goodness, my body feels it intensely. Probably because of you guys. Our episodes really inspire me to take my own health seriously. And you have to prioritize it in the sense of scheduling this time for yourself. Otherwise, it just flies by.
Appreciate everything you said. And I will play devil's advocate and I will say Jesus didn't help me make those flashcards, but I still graduated. Second, I think very highly of taking care of yourself and wellness. And I try to instill that in the new hires that I see now. And maybe it was my accent that kind of led me down this path, but I'm like, that light is going to ring if you're there or not. That phone's going to buzz. Someone's always going to want something. You need to be able to walk away and say, I need to take some time for me. And sometimes, yeah, I will skip my breaks. And I hate doing that because I'm a very strong proponent of taking your breaks and I'm a union rep. But I'm like, I don't want to be here another 15 minutes. Then I have to be. So I'd rather just work through my break and do it. But last week, it was so busy. I said, I just need to step away. And I turned off my little Vocera and took a couple minutes to myself. And I came back and I was fine. I don't equate it to burnout because I've never once felt that. I felt run down. I felt exhausted. I felt like I'm being swallowed up, like I'm drowning. But I don't equate that with burnout. I just equate that with busyness and hecticness. I've never once felt like I wanted to leave the job. Any kind of burnout always came from what I felt that was not the job. Management, rules, stuff like that. But I think we all need to say, I'm a sixth patient. I'm the sixth patient. And I need to take care of myself just as much as I take care of anyone else.
Definitely.
So true. I love that. You're the sixth patient. That's how I used to talk to myself as a younger nurse. I would say, I am this sixth patient. I'm not sure if you all used to do like brains when you would take care of a patient, kind of dividing your paper into 6 squares or 5 squares, and every one of your patient gets a square. My square, my sixth patient would be myself. I would write my name in the square, just like I would write Mr. Smith or Mrs. Jones, and I would put Kellye, and then I would put how many times did I go to the bathroom? How many glasses of water did I drink? How many times did I eat? Did I take a lunch break? Things like that. And that would help me prevent burnout on the unit, to just kind of set boundaries for myself, because I am just as important as these patients on the floor. I have to care about myself. So that was a good point, Eric.
You guys are so good at taking care of yourselves. I never would have thought about that. Well, I think part of why it's difficult for new nurses, especially, to do wellness and take care of themselves is because they don't know how. Most nurses, when they're starting out, are early 20s, fresh out of college, and you are jumping right into a high stress job. And you don't necessarily know how important it is to take those bathroom breaks, or how much water you need to be drinking in a 12-hour shift, or even like what is actually going to make you feel better when you go home to decompress. I know it took me a while to really figure out what to do after work to help me reset. And I think that's something that people should take time into exploring and really get to know themselves for what's going to make them feel better and recharged afterwards. Because everyone can say like, exercise is good, meditation is good, watching TV is good, but you have to figure out what is best for you.
But isn't it interesting? Shouldn't we make that as important as we do the other subjects? Shouldn't we emphasize that? Shouldn't we make that as important when we orient and precept our new grads as we do the other things that we precept and teach them? Because I'm sitting here listening to all this. That was never anything that was emphasized or taught to me as I came along. Shouldn't we? We really should. And like Eric, I think it's great that in your mind, that's just something like, it's okay if I walk away from the call light and if I go take a break, and that is absolutely fine. And I think it is now too, but years later, and as a nurse leader, I think it absolutely is, and it's essential. And part of our professional governance is to figure out how to get lunch relief for people. And we're doing lunch buddies and all that stuff. But if we had taught our nurses all along how to feel empowered to take breaks and take lunches and to feel okay about that, and if it were a habit all along, then we wouldn't be having this issue that they weren't taking lunches and that they weren't taking breaks.
I think we need to see who's going to teach that, because I don't think you mean the facility, right? Because during orientation, we get told that. But then also, don't forget, you got to reassess this pain. Hey, did you document the turn Q2?
No, I agree. So we get on so many tasks and so many things to do that they can't possibly get their things done sometimes. So, no, I agree. So there's a disconnect and a disparity. We're not unionized. You guys are. So there's also that too. But I agree that it's difficult for them to find time. So how do you establish that lunchtime, that break time, and then for them to get all the things done that they need to get done? So I agree.
I have mentored so many young new nurses, and it became a point past them skipping meals and them worrying about time management and worrying about their patients, to the point where I'm like, this is probably something that you should talk to a medical professional about. And I think that that's such a hard conversation to have, of when people should be prioritizing their own health as well, knowing that this job is important. Nursing, you're taking care of so many people, but you also need to take care of yourself. And it can often go beyond taking bathroom breaks.
You have to learn the line in the sand of
Yes.
when it's not all on you, maybe it's a chemical imbalance.
Trish, I agree with the question of whose responsibility it is. Or Eric, I don't know, both of you. Great.
Yes.
I love the back and forth. But the question of whose responsibility it is, already in my personal life, I've talked about this. I have time blindness. I'm delusional about what I can accomplish in 30 minutes. I'm like, I can do this before a report. And then 15 minutes into a report, doing like a full bed change and cleanup. I'm like, how did this happen? Or staying late and finishing my charting because I wanted to make everybody happy, all my patients. I want them to love me at the end of the shift. I think it needs to start in school because we start nursing with our preceptors. No one talks to us about how to organize our day. Like at the most, our preceptor will say, what's time sensitive? Who's got antibiotics? We can't really push this back and forth. We can't really wait on this because it's a diagnostic for this surgery. So we know what needs to come first for one patient, but we don't get taught how to juggle 5 to 6 patients. And I am obsessed with this idea. I'm attached to my sheet. I can never let go of the formula I currently have. I've tried and the whole day falls apart. I do columns. I love the idea of adding myself on column number 6. I've started squeezing myself, my lunch in as of literally 2 weeks ago. And I'm excited about, it's going to sound crazy, making a sheet for my days at home. I've got 4 kids, a husband. I got to add that 6 column for myself for home.
Everything I know is just from being, a Californian. So I know union stuff. I don't know how it is in other areas. We have relief nurses if staffing permits, but it's always there. And we get our assigned times.
We don't, Eric.
Yeah. See, and I was told, or I've heard from other people, they say you kind of just like take your lunch when you can and you kind of work through it, or you'll have your friend watch your patients for you. It's like, I can't wrap my head around it. It's so crazy, but it's just the way I was learned. And I do agree with Sydney, how she said bad parents don't make their kids ready for stress in the future. You learn time management. You learn what's important. You learn how to prioritize. And then you just have to learn to prioritize yourself.
I will say a couple things here. There's a huge variety in time management skills. Because I've been in nursing a long time, there's a remediation that we put people through, and some people never get that ability to work in an acute care setting because of that inability to work with that multitasking with up to, 4 to 5 patients. So then, we referred them to other areas in nursing to work. And now we have a whole different generation of people coming through. We have people that have grown up in the COVID years and have been very sheltered. Think about those people. It's going to be a very different generation of people coming along. I will tell you, I had one nurse that had no verbal communication skills, and no fault of his own, but just wasn't used to talking to people. And he's come along great, but that's been very interesting process. Rose Sherman's blog, she's a great nurse leader. She talks about the different generations, and a lot of y'all are different generations than I am.
It's interesting that you bring up the generation thing, because generation coupled with advancements in technology, AI integration, you mentioned it for school. I can't believe it, but it makes sense. My husband also works in hospital analytics, and they're integrating that as an assistant tool. And it's like revolutionary. Not that I understand any of it, but the generational thing, I think it's also affecting the mental health thing, because all the generations think about it a little differently. Someone older might be like, pull yourself up by your bootstraps. And then the younger generation is like, you need to go to therapy. We clash a little bit, but overall, I think we do need to make some changes in school, because you guys are making me think about it. There's no class that says this is how you organize your day. It's kind of sad. You said you have to tell some people, we tried everything. You don't got the chops, kid, to be in Med-Surg with 5 to 6 patients. School could prevent having to tell someone you don't got the chops, so we can teach you that. And same in the workplace. It's awesome that in California, Eric, right now, the only thing our units do in multiple hospitals is at the beginning of every fiscal year, we have this whole plan, cultural plan of like, you log in and you log in and then you take a turn. By the third month, everybody's over this system that's not actually integrated into the hospital policy. It's just like unit per unit. You guys be nice to each other. I had that issue with breastfeeding because I was pumping. And it became a thing like I just have to ask someone, can you take all my patients? One for my lunch, then two for 4 times a day when I got a pump. It's kind of like people get sick of you because it's not integrated into the day. So I definitely think this is a policy change that needs to happen for hospitals and for schools.
Yes, definitely. And I agree wholeheartedly with that. And there are a lot of evidence-based practice articles that are out. Do you remember the AMSN convention in Austin? Dr. Bernadette Melanick, the chief wellness officer at the Ohio State University, and she did this great presentation about health and wellness. She advocated for like the systemic changes to occur for nurses to combat the burnout, promoting mental health. She talked about all of that as far as clinicians being advocates for ourselves to make sure we are taking the PTOs and we are doing the things we need to do to take care of our health, our mental health at the bedside, and just really speak into thousands of people to just bring this to their awareness. So that's really a thing. So.
Yes.
I also think a little kindness. I always try to see one of my coworkers, ask them how they're doing, ask if I can help. There's those two kind of workers I always see. I see the ones that are willing to help and those that are willing to look out for themselves. But kindness goes a long way to your well-being. Be kind to people.
That's phenomenal. That's phenomenal. And it goes along too with gratitude. Kindness and gratitude goes a long way. Before we close, let's go around and have each of you share your biggest takeaway from this conversation. Trish, what are your takeaways?
I loved the thought of yourself being your other patient and ensuring that you had time for yourself and how much water, breaks. I love that.
Sydney, how about you?
This wasn't really something we talked about, but I think also finding creative ways to boost yourself back up during your shift. When I was working inpatient, we had what was called like the healing garden on the rooftop. And I would always make an excuse to bring a patient up there because it felt good for me to have a little sunshine during the day, a little fresh air. And then it was good for them too, but it was a good way for me to kind of have an excuse to be like, hey, I need someone to cover my other patients because I'm taking Mrs. So-and-so up to the healing garden. And it was good for both of us.
Marcella.
There's a reason why I felt clueless about this when I went into nursing. It's because you guys highlighted we're not taught it at all. And I love those creative ways to find peace in your day, Sydney. It also reminded me of something that we started pushing right before COVID, and COVID snatched it right away. Quiet rooms for us nurses, where on your break, you could go take a nap or just close your eyes. And I think some people still have a little bit of version of this, but ours never got unlocked after 2020. It was like residents took it over as their room, and then that was just it. Just like the breaks, just like the quiet rooms, we got to integrate it officially and not just depend on everybody being nice to each other. Although I love that reminder, kindness, gratitude. I love when a charge nurse is like, Marcella, did you take your break yet? Did you take your break yet? And I'm like, I'm trying to space it in, but they push me and then I do. And then I remember. So the kindness from other people is actually crucial. So thank you for that reminder.
Haley?
My biggest takeaway was definitely what actions we need to take moving forward to prevent our new nurses and our ongoing experienced nurses from having burnout and actually experiencing nursing wellness. Like Marcella said, that starts in nursing school, teaching people how to prioritize themselves as well as their patients at the same time. And also going to what Eric said about how, although he's a union hospital and they have resource nurses to help cover breaks, you don't have to be a union hospital to have break coverage. You can still arrange for that at your hospital system and help keep your nurses happy and healthy.
Eric, how about you?
My biggest takeaway is getting creative with your well-being, whether it be something like kidnapping a patient like Sydney said she did to take them upstairs to the garden, or terrorizing her children through a ring camera like Marcella does when they wake up in the middle of the night.
Oh my God.
As long as it brings you wellness and happiness, we need to find time to be creative and center our own selves, however that may be. And I know you didn't kidnap him, Sydney. I'm just kidding.
I was going to say, is it kidnapping if it's consensual?
You coaxed him.
Like, hey, we're just going for a ride in the wheelchair. Come on.
Y'all summed it up very, very well. Just basically protecting your wellness while you're out there on the floors. And if you don't protect your wellness, tips for this profession is to make sure you're putting your health and your wellness and your mental health first. To our listeners, thanks for joining us. We'll see you next time.
We look forward to connecting with you on the next episode of Med-Surg Moments, the AMSN podcast.
In the meantime, we encourage you to subscribe to Med-Surg Moments wherever you listen to podcasts.
To reach us, use hashtag MedSurg Moments on your social post.
Or send us an email at amsnpod@amsn.org. That's amsnpod@amsn.org.
We're all AMSN members, and if you love Med-Surg Moments, we invite you to become a member of AMSN. You can learn more at www.amsn.org.
Finally, the content within the Med-Surg Moments podcast represent the views, thoughts, and opinions of the co-hosts and may not necessarily reflect the views, thoughts, and opinions of the Academy of Medical Surgical Nurses.
Until next time, this is Sydney,
Eric?
Trish.
Kellye.
Haley,
and Marcella. And always remember, Med-Surg Moments is a moment in our lives and a moment in our Med-Surg careers that makes a huge difference.